could drag another measure in to look at HbA1c. And this measure shows what percent of the patients had an HbA1c result of less than 8. And then we can focus on LDL. And similarly, this measure shows what percentage of the patients had an LDL of less than 100. But the first question that would come to my mind is, well, what time period are we talking about? Because we probably want to focus on those patients who are in our population now. So let's take a look to see how many years are here. So we can drag the year over next to the care team and drop that in. Well, we see we have some data that's pretty old. So we have data back to 2004 here, and that's probably not that useful for an analysis of our current patient population. So one thing we can do is we can filter down to just get the most recent values for each patient. So their most recent blood test, or most recent HbA1c, or most recent LDL. Right click there and choose filter, and then choose yes. This will get us down to just each patient's most recent test. So we'll click OK there, and we see our results get a little bit better, but we're still seeing some pretty old data back to 2006 there. And that's probably because patients, that may be a patient's most recent test, but they could have moved out of the area, they could have moved on to a different health system, or many reasons they may not be in our current patient population. So what we want to do is put an additional filter on the fiscal year. And the fiscal years begin on July 1st, so if we choose July, 2011, that would mean that we would get data from July 1st, 2010 to June 30th, 2011. And then if we also add the fiscal year 2012 in there, we'll be getting that same time period for 2012. So this right here, with getting the fiscal year 2011, 2012, will get us about almost 18 months worth of data. So let's go ahead and click on that. Click OK. So now we're just looking at those two fiscal years and only the most recent test for each patient. And so at this point, since I just want to look at my patient population, I don't really need the fiscal year right now, so I'm going to remove that from the report. So now I can actually see each care team's performance for each one of these measures and get an understanding of how their patients are doing in terms of blood pressure, HbA1c, and LDL. But it's hard to discern maybe where our biggest opportunity for improvement is if you were the overall leader of the Bell-to-Mel clinic, because just you have 3 different metrics to look at and a lot of different teams. So we've added a measure called number of key metrics out of control. Let's drag that onto the screen. So this allows you to see how many of the metrics are out of control for each patient population. And what that means is, again, we're looking at only most recent tests. So any patient could have their blood pressure out of control, or their HbA1c out of control, or the LDL out of control. So any patient could contribute up to 3 to this number of key metrics out of control. So that does give us a little better understanding of which team's patients might be doing the worst. So let's sort this. So now we see that 1 comes up to the top. But the first thing that comes to my mind is, well, this may not be fair, because what if they just have the most patients? And if they have the most patients, then they might have number of key metrics out of control higher than other care teams, but not necessarily because their patients are doing more poorly, but maybe just because they have more. So let's look at the patient count as well. So we'll drag that on. Okay, so we see that 1 does have 69 patients, but down here 1 has 72, so we're still not necessarily clear. What we really need is a ratio. The ratio of number of key metrics out of control divided by the patient count. So let's do a quick calculation, which we can do right here in the tool. So we'll add a calculated number, and you can see number of key metrics out of control is already populated in the area where I defined my calculation. So I'm just going to add the division symbol, and I'm going to say divide by patient count. I have to give my metric a name, so I'll call this out of control control ratio. And I have to select a format and the number of decimal places, and then I can click OK, and it will calculate that ratio for me. So now I see the ratio on the screen here. So now we could do another sort and see which team is performing, which team's patients have the largest key metrics out of control ratio. So we're going to sort that high to low. And we see that comes to the top, but F2 only has one patient, so that care team is probably not the one we want to look at today. But we do see this one is still on top with a 1.0 ratio, but we see that one have the same ratio. So these, if you were the lead of the Bedlam Mill Clinic, might be the care teams that you wanted to focus on first in terms of working with them to make sure they have the right treatment plans in place in order to help their diabetic patient population improve these key health markers. And you could further this analysis by maybe looking at the assigned PCP and dragging that onto the screen, maybe by focusing in and looking at the patient names themselves. And then one scenario you could think about is once you're down to looking at a list of patients, a care manager could actually use the tool and to look up more information about a patient by adding the medical record number to the report, which they can do right here on the screen. Or they might want to add an email address or a phone number to do some communication with the patient. Maybe they see that a certain patient's last tests were really high and that they hadn't been in for a visit in quite some time, so they want to call the patient and get a visit scheduled. All that could be done right here within the tool. So that shows the tool's capability of starting with a high-level set. Remember, we started with a lot of clinics, and we started with a complete history. We saw data back to 2004. And then we're able to work our way down to a specific care team and then maybe a specific list of patients that actually need action taken upon, and then use the tool to bring in those data elements like a medical record number or a phone number to actually take action. So it shows how a tool can start with a high level of data and drill down to the data set that needs action taken. The tool also allows graphing capability. You could turn any report into a graph automatically. You can see the report, the chart that came up here. May not be the most useful chart since we just clicked chart, but nonetheless you can build a chart. Then what you can do if you say this chart is something that you think will be useful week to week to look at, like any other program, you can do a save. And you can actually save that to your own individual sandbox. I'll bring up mine just as an example. I can save this report and then go back to it. And then another feature that is very nice about the Pentaho set of tools is that you could build from these charts a dashboard.